Hello, everyone. Today, we're going to break down antenatal care, or ANC. Now, this is so much more than just a series of routine checkups. We're going to see how this systematic process is really a cornerstone of modern obstetrics and how it works to protect the health of both the mother and the baby all the way through pregnancy. So let's kick things off with something that, let's be honest, trips up a lot of students: obstetric shorthand. You're on your rounds. You see G4, P1 plus 2 on a patient's chart. What does that even mean? Stick with me, because by the end of this explainer, you'll be able to decode that in seconds. No problem. All right, here's our roadmap. We'll start with the why, the real purpose of ANC. Then we'll walk through that all-important first visit. After that, we'll cover the ongoing monitoring, the vital advice and warnings you need to give. And finally, we'll wrap it all up with a super high-yield recap to make sure these key facts stick for your exams. Okay, let's get into it. To really get a handle on antenatal care, we have to start with its fundamental purpose. What are we actually trying to achieve with all this systematic supervision? What's the end goal? Well, the textbook definition is pretty clear. It's the systematic and regular supervision of a pregnant woman. The two key words you really want to lock in on are systematic and regular. This isn't random, it's a planned process with one very clear overarching goal: making sure we have a healthy mother and a healthy baby at the end of it all. So how do we make that happen? Well, first, we screen for any high-risk issues, things like pre-existing diabetes or hypertension. Next, we're always on the lookout to prevent or treat any complications as early as possible. And this is key. Risk assessment is a continuous process, not just a one-and-done check at the first visit. Of course, a huge part of this is also educating the mother, talking through the birth plan, and even looking ahead to future family planning. Now, let's zoom in on that very first visit. This initial encounter is absolutely crucial. It really lays the entire foundation for the next 9 months of care. So, what are we trying to accomplish in this first visit? Well, there are 4 main objectives. First, we need to get a clear picture of the current health of both the mother and the fetus. Second, we have to accurately figure out the gestational age. This is vital for everything that comes after. Third, we get all our baseline investigations done. Blood work, vitals, weight. And finally, we take all that information and build a structured plan for the rest of the pregnancy. Okay, let's solve that puzzle from the beginning. It all comes down to understanding gravida versus parity. Gravida is easy. It's the total number of pregnancies, period. That includes the current one. Parity, on the other hand, refers to the number of pregnancies that were carried past the period of viability. So going back to our G4 P1 plus 2 patient, G4 means this is her 4th pregnancy. P1 means she's had 1 viable birth. And the plus 2, that tells us she's had 2 abortions. See? Simple once you know what you're looking for.
All right, so with that foundation set, ANC shifts into a process of continuous monitoring. Let's take a look at what actually happens in all those subsequent visits that make up the bulk of antenatal care.
You'll notice that as the pregnancy progresses, the visits become more frequent. It's usually every 4 weeks up to 28 weeks, then every 2 weeks until 36 weeks, and then it's weekly right up until delivery. But here's a really high-yield fact for your exams. For a low-risk pregnancy, the absolute minimum recommended by the WHO is just 4 visits. At every single one of these visits, there are a few core things we always check. We track the mother's weight and blood pressure, which helps us screen for things like gestational hypertension and preeclampsia. We look for clinical signs like pallor, which might suggest anemia, or edema for fluid retention. And of course, the abdominal exam gives us direct clues about the fetus, its growth, its position, and that all-important heartbeat. This chart shows a really key clinical tool, the symphysis fundal height. From about 24 weeks onwards, the height in centimeters, measured from the pubic bone to the top of the uterus, should roughly match the number of weeks of gestation. Now, if your measurement is consistently falling below that 10th centile line, that's a red flag for fetal growth restriction. On the flip side, if it's way above the 90th, you might be thinking about things like polyhydramnios or even a multiple gestation pregnancy. Either way, a big deviation is your cue to order an ultrasound. ANC isn't just about clinical exams and measurements. It's just as much about communication and empowering the patient. Giving the right advice, explaining different screening tests, and teaching them about critical warning signs. These are all absolutely essential parts of good care. Let's talk about nutrition for a second. Pregnancy really increases the body's demand for certain key nutrients. We're talking an extra 300 calories a day in the second half. But there are 2 supplements that are non-negotiable: iron, to to prevent anemia, and 400 micrograms of folic acid to prevent neural tube defects. And ideally, that folic acid should be started even before conception. Patients will very often come to you with these minor but really bothersome ailments. For something like backache, simple advice on posture and getting enough rest can make a huge difference. For constipation, it's all about dietary management. And for those pesky leg cramps, making sure calcium intake is adequate can often bring relief. These simple tips can really improve a patient's quality of life. Okay, this slide right here is critically important. Every single patient must be educated on these warning signs. Things like any vaginal bleeding, severe abdominal pain, an intense headache that could point to preeclampsia, or a decrease in fetal movements. These are all red flags that mean they need to seek immediate medical attention. All right, let's switch gears into a quick, high-yield recap. These are the numbers and the core facts that you absolutely need to have locked in for your exams. First up, remember this number, 400 micrograms. That's the daily dose of folic acid. It's absolutely crucial for preventing neural tube defects and should, ideally, be started before a woman even gets pregnant. Next number, 11 kilograms. This is considered the optimal total weight gain during pregnancy for a woman who starts with a normal BMI. And finally, the number 4. This is the WHO's recommended minimum number of antenatal visits for any low-risk pregnancy. So let's just quickly summarize the 3 biggest takeaways. First, remember that ANC is a continuous process of risk assessment. It's not a single event. Second, that first visit is absolutely foundational. It sets the stage for everything that follows. And third, those simple, regular checks, weight, blood pressure, and fundal height, are your primary tools for tracking the well-being of both mother and fetus. And let's end with a final thought to take with you. We've just covered the framework for a normal, uncomplicated pregnancy, but the real question is, how does this systematic approach prepare you to identify and manage the high-risk cases? Because understanding this foundation is the critical first step.